Your Role in Adjustment to Visual Disability, presented by the Massachusetts Association for the Blind and Visually Impaired. Image of a visually impaired woman holding the arm of her guide as they walk through a hallway with bookshelves. Amy Rule, LICSW, Director of Social Services at the Massachusetts Association for the Blind and Visually Impaired, or MAVV. More than 40 years of clinical experience. Image of Amy Rule demonstrating Envision glasses.
Hello, my name is Amy Rule. I'm the Director of Social Services at the Massachusetts Association for the Blind and Visually Impaired. And today we're going to talk about your role in adjustment to visual disability. The Mass Association for the Blind and Visually Impaired, or MAVV as we call it, is a private nonprofit organization. Our mission is to help people to maintain or increase their independence in whatever way they define it. As we often say here, there's no one right way to adjust to visual disability. We work with people who reside in Massachusetts who are blind or have low vision. We provide a number of services, including specialized occupational therapy, technology training, adjustment counseling, peer support groups, and volunteers who assist with such tasks as grocery shopping or reading mail.
Image of a MAVV consumer holding the arm of her guide as they walk outside. Why is visual disability a family, provider, and community issue?
The reasons for that are many. One, which I think is very important to highlight, is that most people who become blind or lose significant vision are forced to manage in a society that is not really prepared to accommodate to their needs. Vision is such a dominant modality that much of the environment and service delivery system is not structured to accommodate people with limited or no vision. In addition, as people age and increasingly live longer, the incidence of many conditions that result in blindness or significant vision loss, including retinitis pigmentosa, macular degeneration, strokes, retinopathy, glaucoma, and cataracts also become much more prevalent. And not only is the individual impacted, but the family and community are as well. You may experience role changes if you are a family member. Perhaps the person who is losing vision becomes much more dependent upon you, at least initially, than they have ever been before. You may need to make some initial decisions or provide more caretaking than you've had to do in the past. In addition, the incidence of visual impairment increases dramatically as we age, and often it is accompanied by increased fear, trepidation, and uncertainty. And there is often a need for many adaptations. There are also important changes, which we will discuss a little later, that are necessary in the community when providing services to this population that need to be made.
Image of an older man with a cane holding the arm of his guide as they demonstrate guiding techniques. How do our own personal thoughts and feelings impact our response to someone who has a visual disability?
Well, let me ask you to perform a little exercise.
Image of a MABV consumer with a cane at a street corner crosswalk with his guide. Activity. What are 3 words or phrases that you associate with visual disability?
If I ask you to think about 3 words or phrases that you associate with visual disability, what would they be? Don't try to overthink it. Just what words immediately come to mind? Take a moment to reflect. If we're being honest, and in my experience, when I ask this question, most people think of words that have negative connotations. Dependent, incapable are 2 that often come to mind. And that is actually not uncommon or unusual. Many people have preconceptions about visual disability. In fact, vision loss and blindness are more feared by some even than cancer.
Quote, a greater proportion of individuals fear blindness than fear cancer or paralysis. End quote.
And there are lots of ways in which these stereotypic thoughts are reinforced. First, there's the insidious impact of language and media portrayal. Do any of you remember Mr. Magoo? Or how many movies have you ever seen where there is a person with a visual disability who is just behaving normally? How many times have you seen stumbling blind people or blind beggars? Even our language can have an impact in a very insidious and way in which we may not even think about it. Phrases such as blind spot, turn a blind eye, blind drunk, blind as a bat, send subtle messages of negativity about blindness. So I invite you to challenge your beliefs and your stereotypic associations. When you think about having a visual disability, you may feel that you could not function and may erroneously assume that because you would have terrible difficulty, that the person you are trying to help or your loved one may feel the same. And ironically, the other side of the coin is equally damaging. I have had the misfortune of being called amazing just because I do normal things. And I have heard people talk with their family members who say, oh, you're so amazing for washing the dishes. Frankly, washing the dishes is not a very amazing thing to do. But somehow we attribute that amazing label to someone, even when they're just doing normal things. People with visual disabilities may do things in a different way by using different techniques, but we're just doing things that are normal for anyone to do. And in some ways, by using the amazing label, what a person is inadvertently saying is that if you do normal things, then you must be amazing because a normal blind person would not be able to do the same.
Image of 3 older women sitting at a table and talking. In your experience, how do people adjust to losing their vision?
Well, I get asked that a lot. And interestingly, many people will call me and ask me, what is the right path to adjustment? What steps do I need to take to adjust in a positive way? The reality is, there's no one path to positive adjustment to visual disability, or probably to anything else for that matter. There are, however, some important things to consider. There are several stages that people often go through. And the slide that is on your screen now depicts these stages as if it is a linear process.
7 phases of adjusting to blindness and low vision. 1. Trauma. 2. Shock and denial. 3. Mourning and withdrawal. 4. Succumbing and depression. 5. Reassessment and reaffirmation. 6. Coping and mobilization. 7. Self-acceptance and self-esteem.
In my experience, at least, it really is not. Many people, particularly people who lose vision gradually, are often stuck in denial. Sometimes, if they're losing vision slowly, they may be able to pass for being sighted in many situations. And they may resist identifying as a person with a visual disability for a very long time, even long after they really should safely recognize it and adapt to the situation. How many people have we met who have refused to use a cane, for example, until they've fallen down a set of stairs? Or how many people have insisted upon trying to read print when it might take them 10 minutes to read one sentence, when using other techniques might be more helpful? But many people also experience significant feelings of loss and grief, and that's a normal process. Most people rely on their vision to do everything until they can't. Vision is often the only way that people initially relate to the world. If you think about it, when we are first born, before we have language, we look around and take in the environment around us. And so for many people, the loss of the ability to view the world visually is a tremendous change and a difficult adjustment. The inability to drive a car, the inability to read print, the inability to travel without thinking about it, or the inability to go into a room and automatically connect with others through eye contact. Those are often very difficult things for people to initially adjust to. And sometimes people are really not ready to embrace the options and resources that are available when they are presented. And that's why, as you'll hear throughout this presentation, it's so important to listen first. Figure out where the person you're speaking with is in the process of the adjustment. Are they ready? Do they reject offers of assistance? Sometimes people really need to have those hard lessons before they will acknowledge that they are having increased difficulty. And sometimes, because so many people feel that blindness is worse than cancer or even death. And yes, I've heard people say, I'd rather not live if I am totally blind. Then They may not be ready to hear your words of wisdom and your helpful suggestions. In my experience, also, this is not a linear process. People don't usually go from denial through grief and loss to acceptance in a predictable pattern. Sometimes people start experimenting and doing things that they're willing to consider doing by using adaptive techniques. And then all of a sudden, they'll have something happen which throws them back into the grief process. That can happen, for example, if someone suddenly realizes that they can no longer recognize the faces or photos of their grandchildren. Or if they go into an unfamiliar building and suddenly realize they can't read the signs. Or when they have to give up that driver's license and get a state ID instead. Often people make adaptations. They take one or two steps forward and then may take one or two steps back. Again, that's a normal part of the process. And really, for many people, there are things that people may never totally become accustomed to. As a matter of fact, this was brought home to me the other day. I was having a conversation with a client, and we were talking about the difficulty that she has in asking people for rides. And as we often do at MAVV, because we try to use our lived experience with blindness and visual disability as we talk to people, because we think they find it helpful. I very offhandedly said, well, I've been doing this for a very long time because I've been blind all my life. And I don't think I'm ever going to get accustomed to feeling comfortable with asking people for rides. It's just not something I think I'll ever want to do, even though I have to, and even though I do it on a regular basis.
Image of a group of older men and women sitting at a table reading flyers. What factors can affect a person's adjustment to visual disability?
Well, there are a number. First of all, let me just say it again. We're not all the same. Everybody has different experiences and situations, values, and responses. So if you think that when you've met one person with a disability that you've met us all, let me disavow you of that. You really can't make stereotypic judgments and draw erroneous conclusions. First of all, there's a double stigma of aging and blindness. As I get older, one thing I notice is that more people call me ma'am than ever used to. And again, as I get older, I experience much more frequently than I did when I was young that people expect me to sit down. My legs work perfectly well, but somehow they assume that because I'm visually impaired, I need to sit, which can often be further from the truth. And that's particularly true, frankly, when I'm going through an airport. I can't tell you the number of times when I have had well-meaning people tell me that they want me to sit in a wheelchair. Now, when I've come off of an 11-hour flight, the last thing I want or need to do is to sit in a wheelchair. But more and more, that's the common response. And I think for many people, often sighted people will assume that if we have one disability, we must have all of them. People will speak more slowly or more loudly, particularly when given directions. I can tell you that a lot of people have experienced times when they'll ask for directions and someone will give rather imprecise directions. And when they ask for clarification, they'll just speak louder. Please don't assume that because I have a visual disability, that I also am deaf, that I'm slow, or that I am unable to walk. I think another reason, another impact is that often people assume that all problems that a person has are related to visual impairment. And that may often not be true. There are times when people will have difficulties or will go to the doctor or go to an office or request assistance, and immediately the people that they're talking with assume that the problem is their blindness and will start asking irrelevant questions about blindness or visual disability when really they may be talking about something else. And that can have a very negative effect on people who are trying to be heard, and may also make it more difficult for people in the community and even for friends and family members to provide positive assistance and to really meet the person where they are and help them to do what they need to do. In addition, and particularly with age, often people have other conditions that have a tremendous impact on their ability to function. So, for example, a person who has Parkinson's disease might have much more difficulty performing some tasks of daily living or using an iPhone, for example, because of the tremors. A person with neuropathy may be unable to learn Braille because they don't have the sufficient feeling in their fingers. A person with a hearing impairment may not be able to travel as easily without assistance because they are deprived of the auditory cues that many people with visual disabilities depend on for navigation. Another factor is the availability of supports and resources. And that's another area where you come in and can be so helpful. Even before your loved one or a person you're treating is ready, it can be very helpful if you identify some resources and supports that are available. And if you do that, then when they're ready, you'll be able to provide needed assistance. And this often, not always, but often can be impacted by socioeconomic status and by the availability of access to technology and to the internet, where so much information resides. Finally, a note about trauma. One thing that we know is that for many, visual disability represents an initial trauma. And if a person has had prior traumatic experiences in their life, this may be particularly difficult because often when a person experiences a new trauma, the impact of past traumas often increases and overlays their response. That's why it's so important that you listen, that you approach someone with care and compassion and patience.
Image of a MAVI consumer walking down a staircase holding the arm of her guide. What suggestions can you give family members, caregivers, or providers that will be most helpful?
I guess the thing that I would most want to emphasize, if you remember nothing other than this from this presentation,
Image of a MAVI consumer receiving assistance from a volunteer on his smartphone and laptop. Listen first.
listen first. Listening is the first step to understanding and providing support. People need to be able to tell you how they feel, what they're thinking, and what will be helpful to them. Each person has unique characteristics, values, and priorities. So it's important. And in many instances, what we find in our work is that sometimes we are the first people who are willing and able to listen first and to try to meet a person where they are. I understand that that can be difficult because you may be going through your own experience of sadness and anger and frustration and uncertainty. But the more patience and willingness to be open to what the person says that you can convey, the more trust that's going to be developed and the better able and more willing they're going to be to share their most important concerns with you.
Image of a MABV consumer working with a volunteer to go through a pile of mail. Ask first, don't make assumptions.
The next thing I would say, again, is ask first. Don't make assumptions. Sometimes people will just decide that a person with a visual disability needs help without asking. And that may be the furthest thing from the truth. If you ask, most of us are pretty comfortable telling you what we need and what we don't need help with. And I always tell people who are experiencing visual disability to try to be patient with the public, because sometimes well-meaning people will do things that are not helpful, such as the day when I was about to cross the street and a person decided that they were going to be helpful, so they picked up my cane and started pulling. Or the time when I was walking into the train station, and when I went toward the escalator, the person started yelling that I should go to the elevator rather than asking me if that would be my preference.
Image of a MABV peer empowerment group with many consumers sitting around a set of tables and talking. Offer hope while you acknowledge the loss.
Offer hope while you acknowledge the loss. It's certainly understandable and expected that people are going to feel that they have lost tremendously when they no longer have good vision. And it's important to acknowledge that and not to dismiss it. But it's also important to remind someone that this may not always be permanent, that they may not feel in this the same way forever, because they can learn to use other techniques to do many of the things that they did in the past with vision.
Image of a MABV consumer using technology to magnify the text in a brochure. Respect where they are in the process of acceptance.
The next thing I would say, respect the person and where they are in the process of acceptance. That's really important. Sometimes if we push our own agenda, and haven't we all done it? But when we push our own agenda, we can make people turn off and be unwilling to listen to us. Accept where they are. If they're not ready to hear about the latest wonderful technology that's going to help, then perhaps wait to introduce it.
Image of an older woman sitting in a chair and talking to a man next to her. Always talk to the person directly.
Always talk to the person directly. I cannot emphasize that enough. I can't tell you the number of times when this happened to me actually the other day. I went to a group meeting, and afterward, several of us went to lunch. And there was a sighted person sitting next to the woman who sat to my left. And instead of asking her what she wanted for lunch, the wait person said, "What is she going to have?" That's very demoralizing. I now have a rather cryptic response that I will share with any blind person who wants to know. So I kind of take back control by saying, I don't know what she wants, but I'll have. But that's really important. Talk to the person directly. If someone is with you and you're assisting them and accompanying them to an appointment, don't talk for the person either. If someone asks you or looks at you while asking questions that really your loved one can answer, let them answer. It's uncomfortable, I know, to avoid people's stares and to avoid the eye contact that they make with you. And you may feel obligated to answer. But the most important thing is for the person with the visual disability to be able to speak for themselves.
Image of a MAPV consumer with a cane crossing an intersection with his guide. Never grab the person.
Another thing, never grab a person. It is very startling to suddenly have someone grab you. Obviously, there are exceptions to that. So if I'm about to jump into the third rail on the subway platform and I've missed a step, then I might decide that it's okay for you to grab me if you must. But except in very, very rare circumstances, please do not grab someone. It is very disconcerting. It doesn't help them to feel safe. And if someone has a history of trauma, it can be particularly unsettling. And it invades people's space.
Image of a MAPV consumer using a volunteer app on his smartphone and opening a door into a building. Identify yourself when you come into a room or are leaving the room.
A couple of quick ones. Identify yourself when you come into a room. That helps someone who is new to vision loss to understand who you are and to learn to recognize you by name and voice, which is a new way of connecting for many people. Notify people when you're leaving a room. I can't tell you the number of times when I have said something to someone only to realize after the fact that they've left silently.
Image of a woman walking outside with her guide and guide dog. Try to avoid areas with lots of noise.
Be aware that areas with excessive noise can be completely disconcerting and try to avoid them when you can. That's particularly true for people with hearing impairments in addition to visual disabilities, but also true for people who are new to visual disability who may find it very overwhelming to hear so much noise as they are learning to use noise as a prominent cue.
Image of a woman teaching a MAPV consumer to use accessible technology functions on a smartphone. Ask about the person's lighting needs.
Lighting can be very important as well. Some people need bright light, and people with other conditions cannot tolerate it. So again, ask about what a person's lighting needs may be.
Image of a MAPV consumer with a cane, walking with a guide and using an assistive app on his smartphone. Give careful directions.
Try to give directions as carefully as you can. You can't point or say over there or that way. Learning your left and your right, particularly if you're facing the person rather than walking in the same direction, can be a challenge. And I often tell people to hesitate before they turn left or right, just to make sure that the person who's directing them is being accurate. Saying left, right, straight, or walk 10 feet and then take a right, or perhaps even more helpfully, go to the end of this corridor and then take the following left.
Image of a MAPV consumer learning to use accessible technology on her tablet. Have documents available in large print or on audio.
Please have documents available in large print or on audio, because many people cannot read the small print that documents are created in. Handling documents and consent can be a real stumbling block. And when asking for consent, unless you're prepared to read the entire consent document, please provide it in a format that someone can access. We need to know as much as anyone else about our rights, about risks, and about what we're signing.
Image of two older women using magnifying glass lights to read flyers. Educate yourself about visual disability.
And also, again, just educate yourself about visual disability. Use some of the resources that we will provide to you. And make sure that you learn something so that when you encounter a person who's blind or has a visual disability, that you can be informed enough so that you feel comfortable.
Image of a MAVI consumer and PEP group leader, Agnes Sigarian. Serve as an advocate.
Finally, serve as an advocate who promotes autonomy and independence. One of the things that makes it difficult for people with disabilities of any kind to make headway in making the environment more accessible to us is that we're a very small minority compared to the general public. You can play a tremendous role in asking people questions. So, for example, if you go to a senior center and you see one of those inaccessible kiosks, you might ask the person at the front desk, how does a blind or visually impaired person access this information or sign in? Or if you find yourself in a bank that doesn't have any option for large print checks, for example, or if you encounter an app that you use on a regular basis or a website, have you ever thought to ask if this can be accessible and has been made accessible to a person with a visual disability? You can be a powerful voice in helping us to reduce the barriers to information and to independence.
Image of a woman talking with an adjustment counselor. What else should disability care providers take into consideration?
When you're providing care to a person with a disability, there are a few other important considerations I want to mention about service delivery, planning, and considerations.
Image of a guide helping a MAVI consumer out of a car. Consider transportation challenges.
One is when you're planning follow-up care, consider transportation challenges. It doesn't help if you assign a person to a service provider who they can't reach because they don't have transportation to that particular town or office. Ask about that, because that can sometimes mean the difference between a person keeping an appointment and getting the care they need and deciding that it's just not worth the trouble.
Image of a MAVI consumer and volunteer organizing a daily medication container. Provide accessible medication instructions.
Medication is another important issue that I want to address briefly. It's important when you're discussing prescriptions and providing medication instructions to try to provide them in a way that a person can access independently. Our occupational therapists often work with people to help them find solutions. But one thing that is available that many people are unaware of is that there are solutions that allow a person to take a prescription bottle, put it on a reader, and have the information read aloud, including things like the prescription number, the number of refills that are available, and what precautions people need to take when they are taking their medications. I think the final thing I would say too about this is I've told you a lot of things that I would caution against and a lot of things to do, and that can be hard to remember. And I think there are a lot of people who are afraid to talk to people with visual disabilities. You may not know exactly what to say. You may be afraid of saying the wrong words. And although I've talked about ableist language and talked about the fact that it's important to be careful in how you address a person, I want to just say that it's just important that you speak to us more than anything. Most of us, by the way, do not flinch when you say, "Did you see that? Did you look at that? Did you watch that program on TV?" Even if we can't see those movies or TV shows, and even if we don't look, I use that vernacular all the time because it's much more common and it's much more natural. So don't be afraid. Talk to us, listen to us, and ask questions when you don't know the answer. Thank you for the opportunity to share some of my thoughts and experiences around visual disability with you. I would be very interested to hear whether you found this helpful and what other questions you have. Is there information that you wanted to obtain that I didn't provide? Are there additional topics that you'd like us to pursue if we have another module like this? Please feel free to contact me via email, which is arul@mabcommunity.org. Thank you again for listening.
Thank you. For more information about the services we provide, visit www.mabvi.org. Resources for accessible services are available at www.mabvi.org/accessible-services. MABVI logo.